Pyoderma gangrenosum in ulcerative colitis. Definition: what is a pyoderma gangrenosum? Pyoderma gangrenosum is a rare, inflammatory skin disease where painful pustules or nodules become ulcers that progressively grow.
Welcome to the Health Channel. Pyoderma gangrenosum is a fairly rare skin condition that affects both males and females. It is not age-defined, but it is more common in the young to middle-aged group. The most likely affected areas are usually the legs, arms and neck, although it can also develop on the head or genitals. Even though Pyoderma gangrenosum is a skin infection, it can bring on high temperature and feelings of sickness. The first indication of Pyoderma gangrenosum is usually the appearance of small red bumps or pimples that quickly grow larger. As the pimples or bumps grow, they then develop into ulcers that are painful and may ooze or weep fluid. The condition is treatable with creams and medication with positive results, but there is a high possibility of scarring. It is important that you consult a doctor or skin specialist before attempting to self-treat, as Pyoderma gangrenosum is quite a serious condition and should be treated properly to minimize the risk of infection or scarring.
What is an ulcerative colitis? Ulcerative colitis is an inflammatory bowel disease. It causes irritation, inflammation, and ulcers in the lining of your large intestine, or colon.
In the spectrum of inflammatory bowel diseases, Crohn's disease and ulcerative colitis are the two heavyweights. They share symptoms but are very different. A key distinction: ulcerative colitis is localized.
It always starts in the rectum and then proceeds up the colon, can involve part of the colon or the entire colon.
In Crohn's disease, inflammation can occur anywhere along the digestive tract.
Crohn's disease can affect the small intestine. Then there's more issues with potentially malabsorption of nutrients.
There's also something in the way they move. Ulcerative colitis progresses in a continuous fashion, while Crohn's can skip around to other organs. It can create lesions and leave other tissue intact, leading to what doctors call a cobblestone pattern. Both these illnesses are autoimmune diseases, each characterized by chronic inflammation.
We don't know what causes that. The theories are that it could be a virus or a bacteria, maybe food antigens.
The inflammation is responsible for the associated pains, cramps, diarrhea, and bleeding. Other symptoms are weight loss and fatigue.
Applications in medicine. The patient showed epidermal and superficial cutaneous necrosis with an underlying mixed infiltrate or inflammatory cells, abscess formation, and leukocytoclastic vasculitis. This result was obtained by the histopathological examination of an incisional biopsy sample obtained from the chest lesion.
Pyoderma gangrenosum. Pyoderma gangrenosum is a neutrophilic dermatosis that presents as an ulcerative skin disease. It starts as an inflammatory papule or a pustule and may progress to become a vesicle or a nodule, and can eventually form an expanding purulent ulcer. Pyoderma gangrenosum can present as a single or multiple lesions, usually on the trunk or lower extremities. It is most commonly triggered by a local trauma due to pathergy, neutrophil dysfunction, and dysregulation of the immune system due to an underlying systemic inflammation are major contributors towards pathogenesis of Pyoderma gangrenosum. At least half of the patients with Pyoderma gangrenosum have an associated underlying systemic disorder, such as an inflammatory bowel disease, or arthropathies, or solid organ malignant conditions, or hematologic malignant neoplasms like acute myeloid leukemia, or other hematological conditions like myelodysplastic syndrome Pyoderma gangrenosum is diagnosed based on histologic criteria and history and clinical exam findings along with treatment findings. The major criterion is biopsy of the ulcer edge demonstrating a neutrophilic infiltrate. The minor criteria include an exclusion of infection, pathology positive, personal history of inflammatory bowel disease or inflammatory arthritis, history of a papule or pustular vesicle that rapidly ulcerated, peripheral erythema, undermining border and tenderness at the site of ulceration, multiple ulcerations with at least one occurring on an anterior lower leg, and cribriform or wrinkled paper scars at the site of heel ulcers, and decrease in ulcer size with 1 month of initiating immunosuppressive medications.
Pros and cons. Pros. Bowel disorder can be treated with corticosteroids and infliximab. This medicine also can benefit a skin condition. Cons. The exact causes of Pyoderma gangrenosum are still unknown. Ulcers of Pyoderma gangrenosum proliferate rapidly. Complications of Pyoderma gangrenosum include infection, scarring, and uncontrolled pain.
Pyoderma gangrenosum is a non-infectious, progressive, necrotizing skin condition. The etiology of pyoderma is unclear. Half of patients have a systemic inflammatory condition, such as ulcerative colitis, Crohn's disease, irritable bowel syndrome, lupus, or rheumatoid arthritis. About a quarter of pyoderma cases begin after some sort of trauma or surgery, but another quarter have an insidious onset. Pyoderma most frequently affects patients who are middle-aged. The pathology of Pyoderma gangrenosum is poorly understood, but is believed to be due to neutrophil dysfunction. The classic presentation of Pyoderma gangrenosum begins as a small, very painful papule, vesicle, or pustule on the lower extremities and/or trunk. While a single lesion is possible, generally there is a cluster of ulcerations that rapidly expands. Pyoderma rapidly progresses to full-thickness ulcerations with irregular, violaceous borders which have purulent and hemorrhagic exudates. Undermining is common. The wound bed is eschar or slough covered, and the wound edges may be rolled. The peri-wound is indurated or boggy. The patient may also have fever, malaise, or myalgia. Pyoderma lesions are erythematous due to inflammation, but may also have a blue hue from epidermal necrosis.
Issues applied in Ecuador. Clinical case. A 30-year-old woman has pharyngotonsillitis and gallbladder lithiasis. At 7 days, a deep ulcer with necrotic borders was manifested. The therapeutic management was carried out based on antibiotics, penicillin, and gentamicin. Then, dapsone was orally taken at a dose of 200 mg daily and local applications of 1/1000 silver nitrate solution. Finally, the patient improved clinically with plasmapheresis and leukocyte transfusion, and complete improvement was observed with total healing of the lesion. Conclusion. Pyoderma gangrenosum is an ulcerative inflammatory skin disorder that can be associated with underlying systemic disease such as an ulcerative colitis.